It's very simple. And every time I talk to people in the diaspora, because the problem will always end up in the hands of people in the diaspora who have to
Right.
fund health.
Right.
So what I keep telling them is allow Innovarex to capture
Mm.
the health status of people that you love now,
No.
not when they need a hospital, right? Because Michael, I literally designed everything the company does where if you give us 1 hour with somebody that you love,
Mm.
we could capture their health status where they are today. And because if you look at how I built the company, so even our comprehensive wellness screening, which I think is about $140,
Mhm.
where we do a complete assessment of where they are today. And from that moment, because we have the best cloud-based electronic health record system in West
Yes.
Africa, I really do
Yes.
believe that.
Mm.
You as the diasporan, for the first time maybe in a healthcare experience in Gambia, you know objectively where your healthcare of your loved one is. And going back to how I described healthcare, from that result, they're on 3 paths. If you're lucky and they're healthy, we'll tell you every single year, repeat the physical or the comprehensive wellness screening. If they need a procedure, we'll refer them out. And oftentimes, people that come too late, we refer them out for a procedure. But most people, we could identify that a chronic condition is present. And almost 40% of Gambian adults that we screen have a chronic condition that could lead to early death, as in diabetes is present,
Yes.
or hypertension is present, or high cholesterol.
Yes.
So now you as a diasporan, we could tell you based on step 1, your capture moment, which is the comprehensive wellness screening,
Yes.
we now tell you what your loved one needs to keep them outside of the hospital and live longer. And oftentimes that may require prescription medication. So now we tell you, don't send them money every single month to your cousin to go to a local pharmacy to buy medication for high blood pressure.
Mhm.
Because up to 40 to 50% of the medications in the Senegambia or West Africa region are counterfeit. They would not pass quality control, right? But also human nature, no human being oftentimes could show up to the pharmacy every 28 days to pick up their medication.
Yes.
Which is why if you look at our business model with Wellness on Wheels, the moment we tell you that your mom or dad or aunt has hypertension or the chronic condition, we build a formulary now to sell you a subscription to make sure at the end of the day, at the bare minimum, they cannot live without medication to keep this disease under control. So, for example, one medication today in the Gambia, for $100 a year, we will deliver a medication anywhere in the Gambia every 28 days.
No.
You say that you live in the USA. There is not a single healthcare organization in the USA that would deliver medication to your house every 28 days for $100, right? So even in Gambia sometimes, and that's where the frustration comes into play, because I think people don't understand value when it comes to healthcare. And sometimes even people in the diaspora, because their parents, our parents feel bad for asking for stuff.
Yes.
So even if you tell them, oh, we need to pay $700 a year for your healthcare, they'll tell you, oh, Michael, that's way too much. I'm fine.
I'm good.
Don't worry about it. Right? But I guarantee you that hospital in Dakar, even if your parent is not going to survive, you will pay the bill.
Yes.
So if you look at end of life, so many Gambian diaspora spend thousands of dollars end of life when they could have spent just couple of $100 early and allow their parents to. So that's what I would say. Allow us to capture your loved one. And if we need to keep them by making sure they get the right medication, access to a nutritionist who understands the diet, access to a doctor, access to nurses who sometimes will go into the homes of your loved ones and they communicate with you as the diasporan where they tell you, We went to your mom, Michael. She's doing okay. She seems a little bit lonely because all the kids were going on. That's where the value proposition is for the diasporans. And I tell people all the time, not everybody could go home. We don't need Gambian diasporans to go home because the Gambian economy will crash and we will go into poverty. We need Gambian diasporas to participate financially by investing in companies that solve our problems, but also patronizing businesses that are catering to our people, because most people in Gambia, their reality is what I've gone through personally from a finance standpoint and from a family standpoint. It's unrealistic for Gambian diasporas to do it. What I do, I could not do what I do if it wasn't for my wife, Adama, from the family that I come with. Luckily, I don't have a mom or dad who depend on me for my survival.
Right.
So they could afford me the luxury of sacrificing at a level that a lot of people in the diaspora, they are their family's breadwinners. They will never be in a position to date, and my wife always counts. I have forfeited almost $700,000 worth of salary in 4 years. Which diasporan realistically could do that in half the year I am away from my family? So for people to think diasporans could just jump and go home and sacrifice for a nation that, if we're being honest, will take you for granted, will make it difficult for you, and they may still see what you're doing and still not patronize your business. That is the reality of Africa. So we have to be honest with the conversation. But I think our company, majority of our shareholders are Black diasporans. Half of my revenue every single year comes from people in the diaspora. So if it wasn't for the diaspora, Innovarex would have been a good idea that died, and I probably would have been back working for Walgreens and maybe die early from heartache or depression or something because it didn't work out. So that's just the reality.
Doc, this is why time constraint is unfair. Because everything you just laid out, and this is why I wanted to have the conversation this way. That's so that practically, and I will. This is my commitment to you. You have a customer in me in having a 65-year-old mother who visited for 6 months, and then we extended it to a year, and she's here. I'm gonna kick her out soon. She will go back home, and as soon as she lands Gambia, we will start with. So here, we just gave an example of what could have been done in 2004 if Innovarex was in Gambia. For what can be done for somebody like me with a 65-year-old mother that I want to give everything Innovarex to, because I know the value of what you present. So where can somebody like me start when she leaves here, maybe end of year, or March or April, and she goes back and now she's in Banjul? Who do I contact first? Where do I start? What am I going to do for a 65-year-old?
Step one is the capture moment, our comprehensive wellness screening. And even if you go to igh.gm, that is where the customer journey begins. If you get a comprehensive wellness screening, that is your baseline. It's a way of us establishing a relationship with her, with you at the same time, which is why if you look at our logo for Wellness on Wheels,
yes,
it's 3 people.
Yes,
it's us, the payer, and the patient. So the foundation is a comprehensive wellness screening. And sometimes we offer a baseline level for free, which we call our What's Your Number program. So we go to villages all the time, screen people for diabetes, hypertension, and get their body mass index. That's their baseline. And based on that, our system takes care of it, because we have medical concierge that immediately after her comprehensive wellness screening, they are calling you now to let you know this is what your mom needs, and this is the plan to purchase for her, which is going to give her, if she needs monthly medications every single month, access to a doctor. The nurses could go into their homes. So the hardest part is just the capture part. Start with a comprehensive wellness screening, and our system is designed to keep inflammation going. And because of our technology, every single time that she has a clinical encounter, you get a report sent to you.
I got an update.
Update. So you know exactly what's going on with your mom.
Yes.
Right. So most people, I tell them start there. But our subscription plans right now, what we're doing in terms of medication subsidy programs, at-home delivery, is unprecedented in the entire region. Honestly, every corner of Gambia, we're delivering life-saving medications for less than $1 a day.
You say region, I talk about the world as a whole. And you're talking about region, I'm talking about the world as a whole. Because the way Innovarix is doing it is not, I went to a school where, I went to a school with, people from about 18, 19 different countries in Africa, Suffolk University in Dakar. So I am that connected in talking to people and their challenges, healthcare challenges for parents, for family back home. And it's the same story. We're not alone in that. But I'll let you finish. So starting with that, starting my mom off, what comes after that? After the screen is what what comes after that as far as the services you present?
This is how the screening goes. We invested in point of care testing technology. Okay. All that means is typically, even within 16 minutes at Innovarix, we could tell you her kidney function level, her liver function level, her diabetes, if there's any signs of diabetes. So we get all this information, and then she sees a medical doctor who now explains to her, but also communicates via electronic health records where she is in her status, her health status. And now we devise a plan that oftentimes the easiest part is if it's prescriptions that she needs, we could take care of that. Every single month, we'll take medications to her, right? Some people in the diaspora like a nurse to go in to check their moms every single month. That's a plan that covers that as well too. So we tell you what plan works for you and put you on a subscription that now continuous care is managed. And the day that I publish the outcomes that we're getting in terms of our subscription care plans, our medication adherence rate is higher than US average. Our hospitalization rates is lower than US average, not even Gambia average, US average, right? Because of the holistic nature of care that we have. And your loved one now has a doctor, a pharmacist, a medical doctor, a nutritionist, a physiotherapist, all around her well-being, which is also a healthcare that is not the model in Africa. Africa, one doctor is making the decision that a pharmacist should make, that making the decision a nutritionist should make, that making a decision that all these allied health providers are doing. And we keep it in one circle, right? So the biggest thing is just allow us to capture your loved ones, and we could help you.
That's the starting point.
That's the biggest point. And every tragic story in Africa that you hear from healthcare, especially from a chronic condition standpoint.
Yes.
The capture moment was too late. By the time they captured where they were from a healthcare standpoint, it was already end-stage disease, meaning diabetes was close to amputation. They had a stroke, right? They had a heart attack. All those things, if you think about it, right? And it accounts for about 40% of the deaths now is NCDs. The capture moment was just too late because we don't have an infrastructure. Our healthcare infrastructure is not designed for preventative care. We have in case of emergency, healthcare system. So by the time you need hospital, you go to Edward Francis, they don't have a solution for you. They send you to Dakar. Most of the times when they come back, the outcomes are really poor.
Just waiting.
So it's just a tragic situation that the whole continent has.